Back pain, not knowing why you're in pain, can cause us to make the completely wrong decisions as to which treatment and which medical practitioners we consult in our care. My name is Elliot. I'm an osteopath with over 15,000 clients now successfully treated towards being pain-free, and I'm going to show you exactly how to tell whether or not your back pain is serious or dangerous. And remember, please like and subscribe so I can help more people just like you become better empowered over their health and fitness.
Now, the main red flags that we're looking for to, which would be associated with more sinister causes like cancer, could be number one, unexplained weight loss of more than 5% of your total body weight over the last 6 months. Another one would be a history of cancer or a family history of cancer. Certain types of cancer would be higher up on our radar. A recent history of serious trauma would indicate, for example, a fracture, especially if you've got a lot of night pain and pain where you can't find ease on position. If you had an extensive fever, a really aggressive fever, or very profuse night sweats where you're waking up and the bed is literally drenched and your t-shirt is drenched, that's another sign. Any IV drugs or immune system compromise, recent infection, and as well as that constant night pain that doesn't ease when laying down. Most of the reason for these symptoms is because your body is trying to fight something. That would be fever because your body is inflamed. It could be the weight loss, unexplained weight loss because you're burning extra calories to try and defend the body against something, or that something is within your body is very hungry for calories, for example, a cancer. So these are the reasons why we look for these signs, and we always balance them as part of your whole case, your case history, because they're always going to be contextual. For example, if you had a real bad fever one night, but you were with someone who was quite ill the day before, our minds are going to be we're going to be less concerned. If you are presenting with back pain that is 10 years old and you had a recent trauma where you didn't actually fall onto that side, or you did but it didn't tend to worsen your back pain, didn't seem to worsen your back pain, these are all things that we contextualize within your case history to see whether or not it's something that we need to worry about. But if any of these resonate with you, then it's worth going to your doctor. The others that we look for are neurological red flags. So that would be where a disc in your lower back is potentially irritating the nerves that go to your bowel. So we would be looking at one, the inability to urinate or dribbling, which is often associated with bloating because the bladder is so full that it can't hold anymore, so it starts to spill out. The other would be fecal incontinence, where you can't help but go for a number 2, no matter how much you try. The other would be saddle anesthesia, which is where you can't feel where you wipe. And the other would be a large loss of sensory and motor control, so strength or movement in both legs. So it's when the symptoms in the legs correlate to bowel and bladder changes, that's where we really start to be concerned. However, other signs for your bladder habits could be frequent urinary infections where the bladder can't fully empty, or the sensation of not being able to fully empty. Things that can mimic these findings are a recent course of opiates like codeine, for example, which can cause an inability for the sphincter around the bladder to relax, so you're unable to go for a number 1, but also it can really clog you up, so you're constipated, for example. But that's once again why we always put these questions into context of your general health. And the last one would be rheumatological findings. These are the ones that we see most often because they're often missed by other healthcare professionals. Now, a rheumatological condition is where your body is trying to defend itself against a threat, but that threat is seen to be part of you. So your body starts to use your immune system to attack your own joints, your own ligaments, your own cartilage, your own tendons, for example. But they tend to show quite clear signs. So we would often ask our clients if you or any of your family members, close family members, have any of the following symptoms or history. So 1 would be dry, red or itchy eyes. 2nd would be skin conditions like psoriasis. 3rd would be symmetrical joint pain, where you're getting pain on both sides of your body. 4 would be a long-term history of digestive upset, like IBS, for example. 5 would be Achilles pain or tendon pain on both sides of the body. So you might feel that your Achilles tendons, the tendons at the back of your ankles, are really stiff, especially first thing in the morning. We'd also ask if you are stiff all over your body or in key areas for at least an hour after waking, and we would also ask if you respond very well to anti-inflammatories like ibuprofen, i.e. does it have a really beneficial effect on your pain. There's also you're more likely to have rheumatological conditions if you have other rheumatological conditions like psoriasis or autoimmune conditions like psoriasis, ankylosing spondylitis, multiple sclerosis. These are all autoimmune conditions. Polymyalgic rheumatica, another one. These are all autoimmune conditions that make having another autoimmune condition much more likely, and that would increase our likelihood to send a letter to your doctor to investigate for inflammatory markers or rheumatoid factor to see if you are likely to have a rheumatological autoimmune condition going on at the time that we see you. So the bottom line is that most back pain is non-serious, but it's worth knowing when it could be serious and when it's outside of the remit of someone like myself as an osteopath. And that's where we always will refer you for further investigations. You don't need to scan most of the time for back pain. It won't really aid you because most back pain occurs from our software, so our experience of ourselves, our experience of our body, and our sensory input from our body, rather than being linked to damage. But like I said, if any red flags are found, then we'll refer you straight to your doctor. But it's worth knowing about these things in case you wanted to make your own self-referral to your doctor, and you can use this as a checklist to get a bit further, a bit quicker.